So, Manira, we know that the CASE project was initially set up to support vulnerable children, to get them to school and keep them there working with their families and their communities. But then the pandemic hit in March and schools were closed, along with lots of other measures to contain the virus. What was the initial impact in our communities?
First of all, a rapid survey was conducted. Through the survey, we found out that communities were not aware of the pandemic. Many of them didn't even believe the pandemic was real. There was also limited opportunities for the community to access the information. So in all, we realized that the communities were not safe of the pandemic.
So what did we do first?
The first thing we did was to bridge the information gap.
And how did we go about that?
The first thing we did was to adapt our existing and ongoing radio program to respond to the local needs of the community. This was delivered in local languages to get communities informed as to how to stay safe of the pandemic. The second thing we did was to also support our community-based facilitators to do house-to-house campaigns in protective clothing to provide awareness, raising and education programs to the community members.
What have you seen locally as a result of those efforts then?
Through this effort, we were able to create a stable community where communities were empowered to work together to be able to contain the virus. We have also enabled communities to become better prepared for additional measures, such as the making of masks and soap to support compliance with the safety protocols to enable them to stay safe. The area recorded low infection rates, and it was attributed to our radio program by the Ghana Health Service of the municipality.
It's been a big learning experience for all of us. What would your top tip be for others?
So my top tip would be working directly with communities to empower them with knowledge, for them to take on their own terms what they can do within their own means locally to be able to stay safe of the virus.